Hi, my name is Ted Hanley, and I'm the executive director of the Jesse Tree. However, I moved to Galveston in 1984 to open our Daily Bread, which is directly across the street from First Lutheran Church, where we happen to be at the moment. And we're here because First Lutheran has undertaken a program to deal with hunger in the community. And when the pastor first got here, he shared the concept with me about packaged meals, and they have asked me to talk a little bit about hunger in our community. It has been my work since I got here in 1985, and the interesting thing about hunger is it's something we all have in common globally. Everybody gets hungry every single day. So the truth of the matter, and anybody that knows the Jesse Tree knows, our issue is finding the root causes of problems. So if hunger is the problem, what we're really looking for is what is the root cause of it. And that, of course, varies from person to person, varies from place to place. And here in Galveston, I think people who take on hunger as a cause are quite surprised to find out who is hungry in our community. And today we happen to be delivering food boxes to Holland House, Gulf Breeze, and the Oaks. And that is where some of the very poorest, disabled, and senior members of our community live. And as people drive by those facilities, I doubt that many people truly understand how few people are eligible to live there. It is based on a very, very low income. It is based on medical or disability issues. And so I personally know hundreds of people who would benefit from having an opportunity to live in a facility like that. They're just not eligible. So hunger really takes you on a journey that helps you learn a lot about the community that you live in. When I first came here, hunger was about feeding the homeless. And what I really learned about feeding the homeless was homelessness is truly a complicated medical problem. It is extremely complicated, involving mental illnesses, involving addictions, involving phobias that people don't even know about. It is a problem complicated by chronic employment. It is a problem complicated by lower levels of education. So the hunger that is experienced by a homeless person, the actual physical hunger, what I learned, is best addressed by something that has electrolytes or whole milk products, because homelessness puts you in such a physical position where you don't get regular nutrition, and your body actually craves the electrolytes and the vitamins that help you think. And so what I learned about working with the homeless was a whole milk product, a bottle of Gatorade, or a fresh piece of fruit is truly the kindest and most healing thing that you can feed a homeless person. And I think everybody knows that they wonder, if you hand a buck to somebody standing on the corner, are they really going to go buy a banana and a bottle of Gatorade? Gatorade's $2.50 a bottle, but they might buy a beer. And we don't want to feed an addiction. We want to feed a human being. We want to feed the wellness. So hunger takes you on a journey that teaches you a lot about yourself, about your own prejudices, your own fears. It teaches you a lot about other people. And for instance, the seniors who are receiving the food boxes today, what I have learned there is that right here in our community, we have senior citizens who, although they may be in public housing, they may be receiving some kind of an income, it is so low that they run out of food by the end of the month. And at the end of the month, that food box is a lifeline to just making it to the end of the month. Politics gets involved in hunger. And I hear a lot of criticism about people who use the system and people who get rich on the system. And what I can assure you is I have sat with each of the individuals living in that senior housing, and the average number of food stamps that a person living there gets is $8 a month. $8 a month. We all go to the grocery store. That doesn't go far. Without that food box, many of the people living in those facilities would have no food in their refrigerator or in their cupboards by the end of the month. There are also other things that hunger can teach us, and that is nutrition. That's what hunger really is craving. It's craving nutrition, and that is good, healthy food that is going to build us up, make us well. And once we started the Jesse Tree, we started integrating healthcare, social services, and ministries, and learning that if you're poor, it is almost impossible to get the healthcare that you need. It is almost impossible to get the food that you need to pay your bills, impossible to get around the community because of transportation issues. And all told, what that results in is people whose health fails, their finances fail, and they find themselves caught in a trap that is almost impossible to get out of. It takes an entire network of people to help someone rise above poverty, rise above poor health. And unless you truly know how to navigate the system, and if there were not ministries that were willing to fill the gaps that people fall into, most people could not get out of it themselves. So hunger is our friend. We all get hungry every day, and it gets us out into the community so that we learn about ourselves, about other people. And I think right now, for me, one of the sadnesses that I see is the economy of Galveston seems to be booming. And yet, who are the hungry in Galveston? They are the people who wait on our tables. They are the people who cut our grass. They are the people that we see doing hard labor, and yet they can't make ends meet. And they're coming for the food. They're coming, especially if they have a healthcare problem. We have developed a chronic conditions management program where we actually teach people how to manage diabetes, how to manage high blood pressure, how to manage the problems that rob them of good health, prevent them from working. All of those problems are best addressed primarily through good nutrition. And so when we can connect people to good nutrition and then provide the health education that they need to learn how to manage their illness and learn how to manage getting prescriptions, which is another whole issue in itself, we can help people get well and stay well and take care of their families. But it's heartbreaking to see how many people are out there who simply cannot do that on their own, working hard, and in our case, most of the folks coming to the Jesse Tree are coming from two-income households that can't make it right here in our community. I always like to call out good examples, and a great example of an employer like Mosquito Cafe that really takes good care of their people. Not every restaurant, not every bakery takes care of everybody as well as they do. But they're a great example in our community of people who provide health care coverage. They know their staff. They know when to step in and to get help for their staff. Great example in our community, and who doesn't love Mosquito Cafe? So I was very excited in meeting the new pastor here at First Lutheran. Very excited when he showed me the project that they're working on, because this is how people learn about hunger in our community. And these are going to be perfect for somebody who at the end of the month has run out of food stamps, has run out of money. Somebody who would otherwise have a bare cupboard will have a meal that they didn't otherwise have. So I am doing what I do because I'm motivated by my faith. I know the people here at First Lutheran are doing what they're doing because they're motivated by their faith. And I have a word of caution. There's a lot of screening going on and eligibility determination. I would hate to ever be in a position of saying no to somebody who's hungry. So I have to choose to work with partners that let me feed the hungry and don't tell me that one person may be screened eligible and one person may be screened ineligible. And it's something we face every day. So I'm glad to be working with partners that aren't handing out eligibility screening and letting us feed the hungry.